go through an overview of some different treatments. Paracentesis is the drainage of a large volume of ascites. A needle is inserted into the abdomen and attached to a drain bag. The drain can stay in for up to 6 hours. Patients are given 7 grams of albumin per litre of ascites drained. Nutrition considerations when seeing patients who are having paracentesis include the protein losses during the drains. So a patient will lose 13 grams of protein for every litre of ascites. Adjusting their weight, so again, because they have the ascites on them, they're going to look a lot heavier than what they actually are, so we need to consider their weight without the fluid. It's also important to look at what their weight was before and after the drains to help with estimating their dry weight. Also considering the effect of the ascites on their appetite. Transplant is a treatment for patients with irreversible end-stage liver disease and liver failure. Patients may only have a few years to live without a transplant or have a very poor quality of life due to the liver symptoms. Transplant is only offered if other forms of treatment have failed. To be assessed for a transplant, patients are seen by hepatologists, surgeons, anaesthetists, dietitians, psychologists, and transplant coordinators to assess their suitability for a transplant. A dietitian completes a detailed nutrition assessment and provides dietetic advice to optimize patients nutritionally prior to the major surgery. If a patient is listed for a transplant, they are put onto a waiting list until a suitable donor becomes available. When a suitable liver is available, patients are called into the hospital for the surgery. The damaged liver is removed and replaced with a healthy one. Patients can receive either a whole or a split liver. Patients are admitted to the intensive care unit post-surgery and progress to the high dependency unit and then to the ward level as they improve. Patients are commenced on immunosuppressants post-transplant and need to continue these for the rest of their lives. Nutrition post-transplant, so some patients are NG fed. Patients, once they are extubated and their swallow is assessed, they start with sips of fluids. They then progress to a soft diet and then back to a regular diet. Patients require a high energy and protein diet to meet their elevated nutrition requirements post-surgery. Due to being on immunosuppressants, patients are at a higher risk of becoming sick from their food. So as dietitians, we provide advice on foods which should be avoided, such as unpasteurized dairy products, soft cheeses, raw or undercooked meats, fish, and eggs. Longer term, these patients are at higher risk of weight gain and developing heart disease due to steroid use. Resection is a treatment for liver cancer. It involves removal of a section of the liver where a tumour is growing. The part of the liver which is removed will grow back within a few weeks. In seeing a patient post-liver resection, you want to be ensuring that they're meeting their elevated nutrition requirements post-surgery. So TIPS is a placement of a stent in the blood vessels which feed and drain the liver. It is performed if there is a block of the flow of blood through the liver leading to high pressure. The high pressure can lead to varices. Variceal banding is when an endoscope is used to wrap a band around a varice to stop it bleeding or to tie off a bleed. We will now discuss some key medications which are often prescribed in liver disease. Diuretics are medications to help the body get rid of excess fluid. They are used to help treat ascites and edema. Some examples include spironolactone, which is a potassium-sparing diuretic, and furosemide. Laxatives are used to treat constipation and to help manage hepatic encephalopathy. Some examples include lactulose, a stool softener, Senna, a stimulant laxative, and Movicol, a stool softener. Antibiotics, for example rifaximin, which is a minimally absorbed antibiotic which alters gut flora leading to reduced ammonia production and absorption. Ciprofloxacin, which is a prophylaxis for SVP. Antiemetics are used for the management of nausea and vomiting. Some examples include metoclopramide, ondansetron, and cyclizine. PERT, pancreatic enzyme replacement therapy are medications which provide the enzymes that would usually be made by your pancreas, lipase, amylase, and protease, and assist with the digestion and the absorption of food. Some brands include Creon, Nutrizyme, Pancrease, and Pancrex. Refeeding prophylaxis vitamins. So patients are at a higher risk of refeeding if they have a history of alcohol excess. Thiamine is used in the metabolism of alcohol, leading to the depletion of the stores. Prophylaxis given is thiamine 200 to 300 milligrams per day, vitamin B 1 to 2 tablets 3 times a day, and a multivitamin once daily. All patients could be on Pabranex, which is an IV B group vitamins, and vitamin C.